Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DH debulking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So today's video topic is going to cover some amazing before and after results from microneedling for the treatment of hair loss. You guys are probably aware that I am a big advocate in the use of microneedling to stimulate hair growth. I've talked about it numerous times on my channel, and I still feel like it's very underrated in the hair loss community. But there's a lot of overwhelming scientific studies and growing evidence over recent years that show that microneedling is indeed beneficial in promoting hair growth. There's also a lot of these crazy before and after transformations from people who weren't seeing any results with the standard hair loss treatment protocol or from the big three, finasteride, minoxidil, Nizoral. But once they incorporated microneedling into their regimen, they saw noticeable improvements in terms of hair density. Obviously, everyone is doing a different combination of things that can influence the results. And, a lot of times it can be difficult to know the true influence microneedling has, especially, if people started it kind of on the same time as the other topicals or drugs. But there is a fair amount of people that feel that some form of microneedling has been a real difference maker, no matter what other topicals or drugs that they were using. And the multiple scientific studies that we actually do have available, without any doubt, indicate the efficacy of microneedling in promoting hair growth. So I'm going to share with you a few examples of some people who have incorporated microneedling into their hair loss treatment and have seen some pretty good results. All right, so this guy goes by username Kazimash, and he shares with us his 4 months of 5% minoxidil once daily, Nizoral twice a week, derma rolling 1.5 millimeters once a week. So, pretty standard protocol. The only thing that I realized that he's not on is finasteride, which is kind of a big thing, especially when you're trying to treat hair loss. But let's go ahead and take a look at some of his before photos here. We can pretty much see some pretty significant thinning going on in the front portion of his hairline. And if you kind of compare with some of the thicker hairs, it's clear to see that he is thinning. We can't really see what the other side looks like, but I'm pretty sure it's probably similar. And then 4 months after a said protocol, we can see some drastic improvement. Now, the hair is obviously a lot longer, but we can see that it's definitely a lot thicker. And, had he grown out his hair in this state without the intervention of any treatments, it's kind of hard to say. Would he really have gotten this much density just by simply growing out his hair? Probably not. And it also looks like over here, if you guys kind of look at the temporal triangular region here, it's definitely filled in, and we can kind of see a more distinct hairline, although it's been growing in. And if you try to zoom in, there's definitely a lot more thickness going on. So, kudos to this guy. It's definitely been working for him. He's obviously a good responder to minoxidil and microneedling. You can kind of see some dandruff on here, which might be why he's taking Nizoral shampoo. But, nevertheless, pretty good improvement. And let's see here, what do we have? Some thick hair, amazing hairline. Did you use finasteride? I started restarting finasteride, blah, blah, blah. So yeah, he's not taking finasteride, but he's saying that he might take it. So it says, doesn't 1.5 rolling hurt? I need to try this. Used minoxidil many times and always stopped. Don't feel it does shit. Finasteride has worked 20 years for me, but losing a little ground. It's just a nuisance for 10 minutes a week. So he microneedles about 10 minutes a week. And let's see here. So how do you use your derma roller with minoxidil? Do you skip a day as you can't minoxidil when derma rolling? I don't skip days. I just wait around 3 to 5 hours and then use it. So I guess, you always want to wait. A lot of people don't wait, and that's when they get, systemic side effects, because you're creating all this wounding on your scalp from microneedling. And then if you were to apply minoxidil right after, yes, it does help with absorption, but at the same time, it's also going to go systemic and cause unwanted side effects. You know, not everyone is going to get side effects, but typically from most of the studies that I've seen on microneedling with the minoxidil, you want to wait about 12 to 24 hours after microneedling before you apply minoxidil. And let's see, going down, yeah, damn crazy results, man. Any shedding? Yes, the entire first month I was shedding like crazy and almost stopped following the regimen, but it stopped by the end of the month. And then, let's see. Yeah, so, you know, basically, I would highly recommend that this guy does hop on finasteride, but nevertheless, you know, this guy was a pretty responder to minoxidil and microneedling, and we can clearly see due to the density increase on the frontal portion and also kind of like top portion of his scalp. All right, next one I have is also on Reddit. He goes by Skumpelskinks. 33-year-old male, topical finasteride and minoxidil plus derma rolling bi-weekly. So the first photo that he took was back in May of 2021, and then this one here that you guys see after is January 15th, 2022. So that's roughly about 8 months of said treatment, and we can see some pretty much significant thinning on the front portion of his scalp. It's a little bit difficult to see because he has blonde hair and he has really light skin. So I think it would have helped better if he were to show us after result in the same condition as his shorter hair in this photo here. But we can see, you know, we can kind of see that pattern right there. Had he not taken his treatment, there's a good possibility that he could have gone towards like a Nord 6, Nord 7 maybe later down the road. But a lot of significant miniaturization going on, and we can see that even over here, it's pretty much void of hair. And then his after photo, we can see some pretty good growth. Same thing for this guy. Had he grown at his hair, would he have had the density that he would have achieved in this photo here? Probably not. It's pretty clear to see that this guy's treatment was working, regardless whether or not there's different, you know, hair lanes. Clearly see that there is some pretty good density going on right there. And let's go and scroll down and look at some of the comments here. So let's see here. Still under a year mark, but feel a lot more density. Topical minoxidil and finasteride twice daily. Derma Pen every other week at 1.5. Still no side effects. So he's using a topical minoxidil and finasteride from the company Hims. And I know they're one of the bigger companies that actually sell finasteride. I didn't know that they actually offer a topical. The fact that you're using topical finasteride and seeing these results is impressive. I was skeptical. Topical finasteride works just as well in my personal experience. I would recommend it for anyone predisposed to depression and or anxiety. So he's kind of like saying that, you know, topical doesn't have as much side effects as oral, which isn't true because I know a lot of people who are on topical finasteride that still get side effects. So as far as my understanding with some of these studies between topical finasteride and oral, since oral is being metabolized by the liver, it actually is a little bit more efficacious than the topical version. But I mean, if you want to try topical first before oral, it seems like there's a little bit less side effects because you're applying something topically as opposed to taking it orally. But yeah, is there a reason topical is better than oral? Some say it's safer. That's not true. Let's see, what else do we have here? Did you microneedle from the get-go or did you add it later on? It says added it really shortly into the whole routine. Did you notice it gave better results once you added it in? He said it was about a month in and I didn't see results until about 3 months in. So he's saying after 3 months of microneedling, he started seeing a difference. He actually went from bald to tressless. So if you guys weren't aware, there's another a sub thread on Reddit it's called Bald, and I guess that's where all the bald people post their results when they decide to shave their head. Dr. Rasman, he's been pretty active on a lot of these hair loss forums and also on Trestless. Before picture has hair that is very short. Your blonde hair makes it difficult to analyze the before picture, but the after picture shows a full head of hair. Wonder how much of that hair was there before. So same thing like what I was kind of talking about earlier. You know, it would have been a lot better had he shaved his head to what his before photo looked like so that we can get a better assessment of the efficacy of whatever treatment that he's been on. But, you know, nevertheless, pretty good results. Yeah, let's go and take a look at another one here. So just some more in between pics. This guy goes by the username Zay's Famous, and it has the thread Fin Min needle. So finasteride, minoxidil, and microneedling. So this guy has some pretty crazy results. So first month, you can see he's been growing out his hair, and there's kind of like that void area where it's been just miniaturizing, and just hair just hasn't been growing in. And then the second month, we can see a lot of improvement. Like you can kind of see like all these like bald patches here, and then we can start seeing all these thinning areas just kind of filling in. And then this third month, we can start seeing a lot of more hairs, almost kind of like creeping towards his eyebrows. And I believe this guy was on topical minoxidil as well and finasteride, which we'll kind of go over in the comment section to find out. But this guy's hair has just been growing in really nicely. We can also see all that little baby hairs and all that, you know, peach fuzz just growing in. And then 5 months in, we can see some more hair growing in. And then his present right now. So after 6 months of treatment, we can see like that whole temporal triangular region has just been resurrected from the dead. Like if you look at his before photo, you know, like it looks like, you know, this guy was probably like a Nord 3. And then over here, he's been back to like a Nord 0 status with some pretty good edges here. So some pretty drastic improvement in just a span of 6 months. Let's go into the comment section to see exactly what he was taking. So he's 21 years old, pretty crazy. Lucky he started early, exactly what I'm saying. And let's see here. Whoa, man, started getting hair everywhere, almost like oral minoxidil looks good. And that's true. Like if you're on oral minoxidil, I've seen a lot of people who's been taking oral minoxidil like 1.25 or 2.5 milligrams. And most of the ones that I've seen, they go from like balding to like werewolf status. So, and a lot of like the hairs, they actually start connecting to the eyebrows. And it just shows the potency and efficacy of oral minoxidil and what it can do. So he said, thanks, and the side effects I experienced were low libido and slight depression, but it only lasted a week when I first started taking it. How many times a week do you take finasteride? He takes it every day, 1 milligram, and 3 times a week should work just as good because they say the average dosage should only be 0.2 milligrams. So dermal once a week, and he uses a quarter size of minoxidil foam. And yes, I use minoxidil right after I dermal. So going back to, I think it was like the first one, you know, you kind of want to wait 12 to 24 hours after microneedling before you apply minoxidil. There are people who still, you know, just do it right ahead just for that absorption. And for this guy, you know, it's been working out pretty well. Are you still doing the whole process? We're just finasteride now, still doing the minoxidil and finasteride, but I plan on stopping minoxidil completely once I'm sure the hairs on my temples become even thicker and terminal. Probably shouldn't stop because if he stops minoxidil, all the minoxidil dependent hairs that's been growing in is going to start falling out. There's a good chance because all of those hairs were revived because of the fact that he was using a growth stimulant like minoxidil. So in this guy's case, I wouldn't stop. And you know, it's never a good thing to stop just because you've seen some growth, because as we know, there's no medication for treating hair loss that is going to be permanent. You have to keep on taking it. And the moment that you stop taking certain drugs after a span of a couple weeks to a couple months, there's a high chance that you might start losing your hair. Was your hairline that low originally? Yup. By the way, I just didn't dermal the areas that were thinning. I did the bald areas as well. So, you know, pretty good results. Hopefully this guy doesn't stop because, you know, like I said, he doesn't want to go back from this to that. All right, let's go and move on. Next one here, 6-month hairline results due to finasteride and microneedling. So it sounds like this guy is not on, Minoxidil. So we can see some pretty significant thinning on his temple region. And then after, we see that it's been completely filled in. The lighting in the back kind of looks similar, so I don't think there's any discrepancy between like lighting or anything that's concerned. Some pretty good results. He went from like a Norwood, I don't know, like a Norwood 2 back to like a Norwood 0. Incredibly good results. No minoxidil. What length do you use, and do you bleed when you microneedle? No minoxidil, and I go 1 millimeter. Tried 1.5, but bled way too much. I felt like LOL. Now at 1 millimeter, I just get a little bit of blood. Get fucked. That's insane. Congratulations, bro. It's a shame some docs aren't willing to prescribe dutasteride. Clearly, it works extremely well. What made you choose dutasteride over finasteride? Probably because it's more powerful and cheaper than finasteride. I don't know if it's cheaper, but we do know that it blocks more DHT, so it is going to be more potent. Yeah, it looks like, just pretty standard treatment. And after 6 months, he responded pretty well to dutasteride and microneedling, and therefore he was able to reverse his hair loss. It also kind of looks like his temporal triangle also kind of regrew. If you look here, it's more linear, it's more straight, versus here it's definitely more pronounced. And as far as like the hair length, it kind of looks similar to what his before photo is. So pretty good results. And then finally, we have this guy who posted on Trestless again. He goes by VJ619. I'm satisfied with the progress I've made. Been on minoxidil 5% and finasteride 1% and dermaroling thrice a week for past 3 months. Amazing results. Sounds like he's on topical finasteride if he's talking about 1%. So let's see. Before, we can see some diffuse thinning going on, especially on the mid scalp and the crown. Also, he has kind of more like a Norwood 3 pattern, maybe like a Norwood 3 diffuse. And then progressing on, maybe this might be like kind of like a shedding phase, or it might be like the lighting, but it looks like he's near his staircase, whatever. But pretty clear to see his thinning. And then over here, we see some thickening going on. We see some hairs that's been kind of filled in compared to here. A little bit hard to see at this point. And then it looks like we're going back this way here. Definitely a drastic difference from here to here. A lot more coverage, although we can kind of see some thinning going on in the crown area. And then over here, so his hair is obviously longer, right? There's a lot of good density, and it looks like a lot of the thinning areas have filled in really nicely. And then finally, I believe, what was his, like 6 months? His hair is basically filled in. Like, he went from this to that. And it's clear, night and day that this guy has shown improvement from his treatment. Same thing here, like if he, had he like grown out his hair from here, would it come to this? Probably not. So whatever treatment that he's been on has been working. And I kind of noticed like a lot of these like people with diffuse thinning, they seem to be good responders, probably because there's still hair that's there that's just been kind of like in the process of miniaturizing, and it fully isn't gone. And it might be easier to resurrect some of these follicles that are miniaturizing versus someone who has kind of like a slick bald head. So pretty good results, man. Like pretty good. I'm pretty impressed. And this is over a span of 3 months. So he's a pretty good hyper responder in my opinion. God exists. Congratulations. And let's see here. So let's see here, blah, blah, blah. What is this? Oh, you posted this workout pic months ago with a full head of hair, so I'm inclined not to believe you. And he says, well, let's go and take a look at this here. So I'm guessing he posted this photo here, which depicts someone with a pretty good head of hair, at least from the back part. And so he's saying the time I got good hair, but later my crown area temple started getting worse. That's when I shaved and started taking treatment. Worth the risk, I can say. Only 3 months, amazing results, blah, blah, blah. Epic responder. Jesus, you dermaroll 3 times a week. He says yes, every alternate day. So he actually uses a 0.5 millimeter, and he uses minoxidil 1 hour after he microneedles to apply minoxidil. Finasteride 1 milligram or 1%, and He says finasteride 1%. I'm using dermal, so he doesn't really explain what he's using, but it sounds like since it's a concentration, it must be a topical. But yeah, pretty good results in my opinion. So that wraps up this video, guys. Hope this video has been educational and helpful. If you guys have not incorporated microneedling into your hair loss treatment regimen, I highly recommend it. There's a lot of good before and after results. There's a lot of scientific studies backing up the efficacy of microneedling. Thanks for watching, guys. If you guys have any questions, make sure to leave me questions in the comments below, and I will talk to you guys in my next video. Take care.